Welcome to the Medical Education Leadership Summit hosted by Sina Foundation in partnership with Sam Houston State University and Workforce Solutions Gulf Coast. Sina Foundation is a nonprofit organization serving the community for more than 2 decades. The services provided include but are not limited to medical, dental, diagnostic, specialty, and mental health/well-being program. This leadership summit designed to convene visionary leaders, educators, supporters, and practitioners at the forefront of medical education and community health innovation in the Houston Gulf Coast region.
Delivering of quality service is very, very critical. And this is what our clinic believes in, because when the patient comes in, if you treat him well, you automatically reducing the stress and anxiety of the patient already when you are giving your best to serve them. So service is the key, and I agree with Dr. Khwaja that this is what should be part of it, the compassion and the passion that this job requires. So that is very, very important.
The focus of this summit is to expanding physician training in the region to address critical shortages of primary care physicians. Strategies to increase medical education at the undergraduate and graduate levels with new and existing teaching hospitals and community health centers. Building collaborative networks. Strengthening partnerships across academic, clinical, and community sectors to shape the future of healthcare. Integrating community health planning into medical education. Exploring innovative approaches to align medical training with the health needs of local communities. Fostering the next generation of physicians equipped to address public health challenges and disparities.
When we talk about pipelines of workforce, we really have to look at how long it's going to take for people to get there, and how do we maximize the people that we do take into medical school to really hope to take people that are going to go into primary care. Because you can't force them, and when people get in and they're like, I have these huge months, I really, really, really want to be an orthopedic surgeon. We need orthopedic surgeons, but we need something, we need primary care physicians as well. And part of what we need to do is a better job of how we accept people into medical school, how we train them during medical school, how we train them during the graduate medical education time.
So I learned that a smaller institution such as OakBend can provide value. We've had an association with San Houston State since they established their medical school. And I was, again, worried when we did that. I said, I'm happy to help out. I think would love to do something valuable, but are we really going to give your medical school students the experience they wanted? Because, in my mind, I'm thinking bigger is better. And that's, you got doctors have got Harvard degrees, and et cetera, and that's intuitively, that's just got to be better than what little old OakBend can offer. And turns out that we do offer something that is valuable. We've heard lots of very favorable feedback from our San Houston State medical school students about rotating at OakBend.
Governor's Healthcare Workforce Task Force talked about expanding healthcare workforce pipeline, modernizing education and training, increasing the graduate medical education capacity, and prioritizing underserved areas. And so the Gulf Coast Workforce Board, one of our primary areas of support is healthcare. And we know that we have to be able to build a dramatic opportunity of a coalition of persons that can be invested in focusing on how we're going to be able to address those issues, whether it's here at the state capitol or also in Washington.
And I think that the brilliance that's in front of us now is the opportunity to be inclusive of the academic giants, to leverage the fact that you're in the shadow of the greatest and largest medical school in the country, and to embrace them in the model for what the community needs in terms of its educational capacity that may be very different 10 years from now if the community blossoms and flourishes. And to have those dynamics with the large academic institutions, we call those community health academic edible partnerships.